Hey guys, so I'm a senior nursing student and I just took the ATI MedSurg 2023 exam. I got a 92, which translates to a level 3, and I'll tell you what I did and what worked for me personally. I do want to say though that what I did might not work for everybody else, so I'm just trying to give some tips on things that I did that helped me get a level 3. So for this exam, I didn't read the book. For all the past other ATI exams, I always used to read the book, but who has time to read this big medical surgical book? So instead of reading the book, I did a whole bunch of practice questions. I did practice A and B for the med-surg part, and I did that twice. And I made sure to read all of the rationales, and I also did the ATI dynamic quiz for the medical surgical. I think there was like 600 or something. I did all of those, but I didn't do them like all in one sitting. I've been doing it throughout my nursing program, so whatever questions I didn't answer or whichever ones I got wrong, I would go back and do those. And then I did the standard quizzes, which is under the assessment learning systems 3.0 tab, and I did them all for the med-surg unit, so like endocrine, immunity, cardiovascular, respiratory. I did all those. Also, ATI for me, they added a new section. It's called NCLEX Prep, so I did 190 questions on that for just med-surg. So what I'm basically saying is that I did a bunch of practice questions to study for this exam, and I feel like it really did help me, especially reading the rationales. I also looked at Quizlets, but I mainly stuck to ATI because it's an ATI exam. So for the capstone part on under the NCLEX Prep, I did also the the pre-quiz for medical surgical. So studying wise, I only studied for, and I have it written on this calendar, I studied on Sunday. My exam was on Wednesday, today. So I studied on Sunday for 6 hours, and then on Monday I studied for 5 hours, and then yesterday I probably studied for 1 hour. So in total, 3 days, just 6, 5, and 1 hour.